Welcome to a video where we will review and explore spaghetti diagrams. If you are new to spaghetti diagrams, this is an example of what one looks like. As you can tell, the tangled lines on the diagram resemble cooked spaghetti noodles. This is where the name comes from. You might be wondering, when could I use a spaghetti diagram? A spaghetti diagram can be used to track and understand movement. The movement could be of people, including patients and providers, as well as objects like medications, charts, and lab results. Now let's take a look at an example of an improvement activity from the pre-assessment clinic. This is a clinic that had various types of patients coming in prior to surgery to assess their readiness. One common type of patient was the orthopedic patients. These patients often had mobility issues. In the scenario above, the patient registered on the first floor, then needed to move up to the fourth floor for practitioner assessment. And while they were on the fourth floor, they had to move from room to room, from practitioner to complete the assessment. To learn more about this process from the patient perspective, the team observed patients coming into the pre-assessment clinic. They followed the patient from registration on the first floor all the way up to the fourth floor, where the patient moved from room to room, from provider to provider. The total distance that these patients traveled on average was 249 meters, or 983 steps. The team generated ideas to reduce the amount of walking for patients and to improve the flow of the patient. Doing this, they followed the PDCA cycle. The first idea the team had was around how the patients were roomed. In the current state, patients had to move from room to room to see the providers. Each provider had their own assessment room where the patients came into the office to see them and had their appointment. The team had the idea to test rooming the patients and having the providers move to them. Now that the providers had to come to the patients, this provided one extra challenge, is that some providers needed some supplies with them when they were assessing patients. So the team generated an idea to create a mobile cart that the providers could take with them from room to room to assess patients. This meant that the patients could stay in the assessment room with reduced travel, and the providers had access to the supplies they needed to do their assessment properly. In the current state, patients were required to walk throughout the hospital to the lab to get their lab work done. This added extra movement for these patients, and the location was not easy to find, often with patients unable to find their way and easily getting lost within the hospital. The team had the idea of having the lab come to the patients to do the blood work. This meant that the patients were moving less and not getting lost. All of these great ideas were tested and implemented by the team, and this meant less movement for the patients by bringing the services to the patient. This was the result after the changes. Patients moved an average of 90 steps, or 59 meters. This meant that patients moved 77% less than they did prior to this activity. You might be wondering how you can get started using a spaghetti diagram. In this next section of the video, we will highlight key steps to getting started. The first step in using a spaghetti diagram is deciding on the process that you want to observe and understand more about. The problem for this team is that the medication orders don't always make it to the pharmacy, and the patient does not always have their medications when they come out of surgery. The process that they decide to observe and follow is the flow and the travel of the medication order. Now that they have identified the process that they want to observe, they can sketch the layout or use an existing floor plan on the spaghetti diagram template. This is what the floor plan looks like for this team as they prepare for this process. Now that the team has identified the process and has a base floor plan, they can now draw the movement. The team follows the medication orders throughout this process and sketches it out on the floor plan. The fourth step is to record the time and distance. The team observed this process many times of the medication reconciliation flowing through the process. The most reasonable time that this process took was 2 hours, 36 minutes, and 7 seconds, and traveled an average distance of 363 steps, or 544.5 feet. The next step is to identify opportunities to improve this process. The team noticed that there was lots of movement between the providers and the fax machine, and they also noticed that the timing of the medication reconciliation was often after the regular hours of the pharmacist. They started to generate ideas and came up with some great ones to test. The team tested a new system of scanning the post-op medication orders and sending them to pharmacy from the recovery room. They eliminated the faxing step. Now the team could draw the new way of working. The team followed the new medication reconciliation process and drew this on the spaghetti diagram. The simple change saved 2.5 hours, and it now takes 13 minutes and 24 seconds for this process. More importantly, the medications are now ready on the unit for when the patient has done surgery. The medication reconciliation itself also moves less, 278 steps or 414 feet. The next step is to document and train the affected staff. The new process was documented in a work standard, and staff were trained accordingly on the new process. So dive in and have fun using spaghetti diagrams.